Hi, today I'm making two different videos actually within one. One is going to be post rhinoplasty syndrome part 2. I made a video and you can link to that and watch it. It's very important. The nose is a very psychological thing, and rhinoplasty is a psychological surgery. It's not a simple surgery, and you have to be so careful because unfortunately after that you can have a little OCD and get stuck and then keep going downhill on doing more and more and more and more and more. And it's a phenomenon that can happen to anyone. It doesn't mean that you're crazy or something. I've seen it happen to myself. I had my nose job done, and afterwards I started noticing like maybe I need a little more here, maybe a little more there, and then I was like, aha, cannot do that. And so that's very important thing to remember. I have a saying about rhinoplasty, so all those patients out there, please remember, for rhinoplasty, quit while you are ahead. It's a slippery slope, so be very careful. We have a lovely lady here. She came all the way. Oh my gosh, she had to take a train as well and everything, and I felt so bad because I told her not to do anything. She has had 2 or 3 rhinoplasties. She had rib graft, she had an L-shaped strut that was removed, she had implants put in underneath here, and she feels stuff like it's not right. So I had to tell her, no, it is right. You need to just let it go. And it's very hard to let it go. So she asked me like, how do I let it go? So I told her, number one, meditation. Get into meditation, and that's going to make a huge difference, because meditation teaches us to let it go or let it be. If that doesn't work, see a therapist. A lot of times you could have a little mild OCD to begin with, and that manifests after a rhinoplasty. So you have to be careful. If a therapist can't help, then maybe go to a psychiatrist and say, listen, maybe I need a medication to fix my OCD. So that's a step ladder progression from one thing to the other, just to help yourself so your mind doesn't get stuck on it. There's a lot of patients I've seen over years, and it doesn't mean anything is wrong with you mentally, not at all, because if it is, then I'm with you, because I had the same feelings. Fortunately, I meditate, so I was able to let go. And like a little tiny little thing here and there, who cares? I got a beautiful nose, it's improvement, I'm very happy, and I'm very thankful to my surgeon. Now let's take a look over here. So when we look in his nose, I want to hide the identity of our lovely patient, so I'm not going to show you the whole thing. And you can see it's a beautiful nose. My goodness, I would trade with her actually. And everything looks great. And when you're looking, you're like, wow, that's a nice nose. But for this patient, she feels that the right side nostril is higher, the left is lower. And she also feels that maybe the lip is getting longer, this columella needs to be pulled down. And I explained to her that nose looks very good for the face. We do not need to do anything. The right side is a little higher most likely to begin with. And if not, it could have been just the scars here that pulled it up, but I doubt it. In my experience, a lot of times it's up to begin with and the patient didn't notice it prior to surgery. And what I also noticed is patients have like one muscle stronger on one side than the other. And this is typically is that, the nasal muscle in here that is pulling stuff up and pulling it stronger, or it could be just your zygomaticus minor pulling it a little higher on one side. So you don't have to worry about this mild asymmetry. You have to just leave it be. And this is a good nose. We can definitely leave it alone and not worry about it. If you try to fix the asymmetry, it's going to be very challenging. A lot of times the curve that you see right here, patients want to change it, almost impossible. If there's a difference between two, very difficult to almost impossible. Trying to fix it only gets worse. So the take-home message is that asymmetry is common. Don't worry about it unless it's gross asymmetry. And with the nose, if you get stuck on it and you want to keep making improvements more and more and more, please stop and quit while you're ahead. That's a take-home lesson.